Today, we welcome Dr. Feroza Arbee, a psychiatrist specializing in postnatal depression and working with moms. Feroza, welcome. Thank you for joining us today.
Hi, thanks, Nicole. Thanks for having me.
Feroza, we've been talking a little bit. We know that it's quite difficult conditions for everyone at the moment. People in lockdown, people are feeling anxious and uncertain. I wanted to ask you, are moms giving birth at the moment more at risk? Well, what are your thoughts?
Nicole, I think everybody who is predisposed to anxiety is predisposed even more. I think people who usually even have their anxiety under control are currently feeling a little bit more anxious than they usually do because the world is in flux. Living through a pandemic is like living through a trauma. And I think we need to understand that for a lot of us, our survival skills will automatically go into how we deal with the trauma. So being pregnant and having a baby is a big enough challenge as it is when life is normal. Life is not normal right now. So I think mom is under a little bit of a bigger risk, especially if they're being isolated from their support structures right now.
We know that moms going into hospital, dads can be there for the birth as far as I understand, but quite soon afterwards are having to leave. So moms are in hospital for a few days on their own. What are the implications of that?
It's such an important time. I mean, it's a huge milestone for a lady to go into hospital, give birth, bring this human being out into the world and have her support structure, her partner not there with her. That's a huge blow. That's such an opportunity for bonding for both of them as a couple, as well as dad with baby, mom with baby, and just knowing that there's a shoulder for her to lean on. It's scary. Right now out there is scary. Going into hospital is scary. Maybe mummies are not sure what's going to happen. Am I going to be allowed to have my birth partner with me? Is my doctor going to be available? What more would I need to do? How strange is a hospital going to be during the COVID pandemic? Am I at higher risk of getting COVID or giving my baby COVID if I go to have a baby in the hospital? So there's all these uncertainties that are already there, and then not having your partner there, that's definitely going to impact negatively. So there's currently guidelines that have been released by the South African Society of Psychiatrists that strongly advocate for the partner and the birth partner, specifically the dad, to be available during the birth process. This is a very, very vulnerable time for new mummies. And so we feel very strongly that the birth partner should be there.
So actually for all moms, this is that much more stressful, more unknown at a time that is particularly vulnerable for moms in any case. It's all the more so for all moms. But I'm also hearing you say that those with a predisposition towards depression, towards anxiety, are all the more kind of vulnerable and I guess need to be taking steps to protect themselves and their babies and their loved ones.
Strangely, Nicole, the past few weeks I've been doing I've obviously been carrying on consulting with my patients, and there's two scenarios that have emerged. One is that some patients or some people are experiencing anxiety more than they usually do. So the predisposition is there. And actually for a lot of my patients who've had depression and anxiety, the lockdown has been very containing. So I think it very much depends on the perspective here. And you can look at the lockdown as being a forced time to just reset, recuperate, and just think about things and find your perspective again. Or you can look at this as being completely overwhelming. So a lot of it has to do with perspective right now.
So, I mean, I would imagine for moms, I guess it's about being honest with yourself about what is this like for you? What are you feeling at the moment? How are you experiencing this? How are you understanding what's happening? And are you finding it containing and kind of helpful? Or is this something that has really set your anxiety kind of through the roof and you need a little bit of support?
So my advice to people have been, sit down and look at what is in your control. You're not alone. There's a lot of comfort in knowing that we're not alone. And if you put down what is in my control, I can't control that I can't leave my house right now. I can't control what's going on in the outside world, but I can control this little space that I'm in. And in fact, because the space has been made smaller, it's a little bit actually less to control. So if you look at it like that, all you actually need to do is provide. Have regular meals, get regular sleep, make sure your day or your routine is divided into, is a bit of a balanced routine, and that's what you can control. So when you take the other stuff out of the equation, suddenly it doesn't look so bad anymore. There's a little bit less to worry about. And for new mommies, this means less visitors, less people touching your baby, less stimulation, less getting dressed and getting into the mall or to the shopping centers with your baby in a new uh, carrier or in a new pram, a whole lot of other extra things that you would ordinarily worry about that's now actually being taken away from you.
Right.
So there is time to sit and bond with baby. And thank God for the internet and Wi-Fi, because you can connect with the outside world. Just because you're physically not close does not mean you should emotionally not be close as well. There's so many more ways of connecting now. And you can do this from the comfort of your own home on your terms and conditions.
Mm. You get to control who comes into your space and who you can keep out.
Absolutely. And not worrying about who's picking up your baby and rocking them too hard, who's not washing their hands, who just coughed over your kid, and all the other things that come with normal momming.
Yes, yes, absolutely. Now, for those moms who are not coping, what are some of the signs that they should be looking out for that are telling them, hang on, this is maybe harder than not much less manageable? What are some of the signs that some moms could be aware of that kind of says, maybe this is a little bit challenging and you need a bit of support?
So we're going to look for the basic signs of depression and anxiety. And these, in new mummies, this looks like emotional sensitivity, easy to cry, feeling quite depressed, anxious. So you may have physical symptoms of anxiety, feeling like there's a knot in the pit of your stomach, your heart's racing, your heart's pounding, your mind doesn't switch off, your mind's racing, an inability to distract yourself, inability to focus on the task at hand, maybe ruminating about what's going wrong and what you can't control, inability to bond with the baby, inability to maintain a balanced sort of routine with baby, taking some time out for yourself. And then at the worst, we look at having harmful thoughts towards oneself or towards the baby.
Mm. And if moms are starting to pick up, some of these symptoms that you describe, what's your advice? What's available to them? What can they be doing to support themselves?
This is general advice, but I'm going to specifically make it towards moms. Stay away from social media, or the negative social media, as I call it. Try and tune into the positive stuff. There's lots of help out there. This pandemic has brought out the best in people, but there are certain people that are going to spread negativity regardless.
Yeah, we see
so stay away from them. Absolutely. So limit your amount of time on social media if you know it's going to be negative. Find the positive situation. So there's lots of people offering support right now. There are lots of counselors, psychologists, psychiatrists that are available, still providing online consultations. Some are able to even provide pro bono services. The hospitals are still admitting emergency patients, not that we're even considering that, but there's lots to look at, and there's lots of resources online. SEDEC has got a wonderful website as well that's got lots of information. But some of the things you can do is write down, journal, write down the things you can control and the things you can't control. Eliminate the things you can't control. Look at the things you can control. Get yourself into some kind of routine. It does not need to be on the hour, every hour type of thing. Just say, you know what, I'm in survival mode. I do not really need to thrive right now. This is a trauma that I'm experiencing. If I can just survive, my baby and I can just spend quality time with each other, that's all that's necessary. Feed baby, change baby, spend quality time when you can. Feed yourself, have a good shower or a bath, exercise a little bit, and hand the baby over when you're feeling overwhelmed. Also retain your connectivity. So there's certain milestones that are going to happen once baby's born that you would ordinarily share with family and friends. That's not going to happen now. Find other ways of celebrating that. So schedule Zoom meetings with families, Zoom parties, WhatsApp video, FaceTime, Skype. There's so many things out there that you can actually do, and then commemorate those milestones so that you're able to share them with the people you need to share them with, and maybe even commemorate them or celebrate them afterwards. Take lots of pictures, take videos, send them. So there's so much that it can actually be done. The lockdown can actually be utilized in such a constructive way. Babies don't need to be socialized and go out there and be exposed to. So the lockdown's not affecting your baby. It's just your mental frame of mind that you need to optimize for the situation.
Right, because of course we know that affects baby. I think we know it's very hard to bond with your baby, to be close to your baby, if you yourself are completely overwhelmed, depressed, and not coping,
Absolutely, yeah, absolutely. For moms who really are not managing at all, We've got some advice as well for the partner or the other support structure in the house for them to notice some symptoms and signs. But for mommies, help is out there. There's even medication you could take that will be fairly safe during pregnancy, fairly safe during your breastfeeding and postpartum period as well. That could just take the edge off. Obviously, medication is not first choice, but it is there as an option, and do not shy away from things like that. If sleep is the issue, you can take something to help you sleep that will be fairly safe for the baby in the breast milk. There's even stuff that you could take when you're having a panic attack or feeling overly anxious that could work in that moment within minutes to make you feel calmer and a little bit more in control of the situation. But lots of consciousness, lots of grounding, lots of just self-awareness of where you're at and what that feels like for baby. So if you're calm, baby will be calm. Sometimes it's more harmful for baby to be exposed to your stress hormone than it is for baby to be exposed to a little bit of medication. So it's always something for mommies to consider. And for partners, I would say have a look. If your partner's overly obsessed, doesn't seem very functional, just not getting stuff done, unable to focus, you need to intervene. You need to step in there, say, take a break. Let me take baby from you. How can I help you? How can I assist you? Would you like a cooked meal? Can I rub your back? Would you like me to call someone for you? Just basic support that I think the key message I want to send out there, just be a bit more aware and a bit more self-caring at this point.
Mm-hmm. I mean, I think that's the message we've been trying to bring across the whole time is never has it been so important for parents to be aware of their own state of mind and to put things in place themselves, exactly as you're saying, that is within their frame of control. But where that's not enough, to realize that really support is available and to reach out, both for themselves and for their babies.
Absolutely. And like I said, there are lots of counselors out there, but there's this wonderful therapy called parent-infant psychotherapy. So if you're struggling to bond with baby, find a therapist who does that, and they can sort of guide you through the process of establishing a bond and establishing an attachment. These early weeks are so important for that, so important.
Thank you, Feroza. And just to say that what we've done at GAME is we've put together a list of those psychologists. It's available on our Facebook page. So for those mommies looking for that kind of intervention, we can help facilitate that. Feroza, thank you so much for your invaluable advice for moms out there.
You're welcome, Nicole. Stay well, hey?
You too. Keep well. Bye.